Hello, 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 friends and family. Oh, it is Monday, and it's time for Monday Nurse's Life. This is your hostess, Sharon Herbert, the Power RN, and we're coming to you live from Power in Nursing Innovations. So today, the topic is Nurses' Life Matters. What do you think of that? As we come together once again to share and care, I want to ask you a favor. If it's okay with you, I want to kind of go back to the beginning for those of you who don't know me. So I would like to reintroduce myself. If that's okay with you, it'll be brief. Again, I'm Sharon Herbert, and I've been a registered nurse for several years. I'll even say decades. I've been a registered nurse, and my brief story is that I've wanted to be a nurse since I was 5 years old. And I became a nurse because my mom had friends who were nurses, but no one in my family was. But it made me want to do it because they were successful. So I became a registered nurse and I started working in pediatrics, neonatal care for to be specific. But my drive for finding out more about nursing just kept bugging me. So I kept finding out more, getting more certifications, new specialties. I loved policy and procedure and writing and teaching. And so I kept doing that. And after 25 years in neonatal intensive care, I decided I have my master's degree and there's still something eating at me. So I made a change and I started working for myself, actually helping a friend of a friend start their home health care agency. And for me, that was the bomb. Not in the explosion, but that was my joy. That was my joy, helping others to grow and be successful. And so that's what I still do. After many years doing that thing, I became ill. I had a stroke. Yes, I had a stroke. And it made me change my focus. My focus to continue to work with organizations to start their agencies led me to work with caring and sharing for nurses. And today I'm a nurses coach and motivational speaker. My life is still all about nursing, and my drive is to help nurses be successful. And as a matter of fact, I now specialize in working with nurses who are overworked and overwhelmed with the day-to-day drudgeries of nursing. And I help them deal with their stress and avoid burnout. In addition, reigniting your passion and purpose for nursing is all about getting you to continue to do what you love. What you love. And that is the purpose of Power in Nursing Innovations. That's why we're here today, to help you to continue on your path to success. And that is through one-on-one and group coaching. We've been lots of places in the world of nursing. I've even been a nursing faculty. I know what you've gone through, and I know what you continue to go through. But at Power in Nursing, we have an advantage. As Registered Nurse Forum, we're able to help you get through and not make some of the falls that we've even made, and to help you find your light at the end of the rainbow. It's possible. It's possible. We pair you up with nurses who have been there before, and they will help you by being accountability partners and mentors to help you make it through to your success. To start each day by affirming yourself, who you are and what you do, and being able to share that claim, evidence, and information with your colleagues. You know, some nurse colleagues don't even know what nurses do. Do your doctors know what you do? Do they know how invaluable you are to the care and service of the patient populations in the hospitals or even in public and community sectors? Do you help people to be their best and to monitor and achieve health and wellness in your community, in your churches, in your grocery stores, in your schools? Those are the things that we must share with our communities because, community and communication go hand in hand. Striving to meet relationships is what nurses must do in order to have your community and the public and your patients, clients, customers know, like, and trust you. Now, each year we've been on the front cover of the magazines that say we are the most loved profession. We are the most loved profession year after year after year. And we will continue to be that. We will continue to guide and help each other to achieve the place in the hearts of the community that will let us help them to achieve their health and wellness. We just had that horrible COVID pandemic, and despite what the public hears, COVID isn't over. It may not be a pandemic, but COVID isn't over. Folks are still getting sick with COVID. And, of course, there's the flu. There's MRSA. There's RSV. There's always something. There's always new information that we can share with our community to help them achieve wellness. We know if there's not one of the things we already talked about, there's always still heart disease, stroke, diabetes, obesity, mental health challenges. And the public relies on nurses to help them through. They know that nurses answer their questions after the doctor has finished having their 5-minute talk about what the future holds. You can ask your patient if they have any questions, and as they look at you with that blank look, you can also ask, did you understand what the doctor said? And you may also ask, is there anything that I can make clear for you? And they will say yes, yes, and yes. You can help them know what to expect next, and explore questions like their environment, where they live, what services are available in their community. Do they get to choose from venues that have fresh fruits? And do they live in a place or space where they can get out and exercise, take walks, breathe fresh air? They will tell you, and you can help them with the next steps. Is there a pharmacy for them to get their prescriptions filled? Do they have money to do so? I heard a story about a man who'd been in the hospital for several weeks, and after his heart failure, he'd finally been discharged from the hospital. Well, he went home. Well, I'm not sure exactly what falls that he could have occurred. Those things really showed their ugly heads when he was readmitted, because he's in the emergency room and he's having some troubles, and he has the prescription for his medications right there in his pocket. 2 weeks after he's been discharged from the hospital, he hasn't gotten a single medication. So, when the intake person asked him why, he said that he didn't have any money to get those medications. Unfortunately, that 2 week that 2 week discharge time didn't turn into death for that guy, for that, as I would say, young man who was promptly discharged at the time when the clock ticked. But he wasn't able to get the medications that he needed to stay well. We have a couple of ways that we can help. Nurses can help. And we also have case managers, and that's a sector of nursing. We also have home health care nurses who see those patients or can see those patients at home if those patients' insurers agree to have that service provided for the patient. And everyone doesn't have that. By the way, home health care was one of the ways that I chose to serve the public as I was helping the organizations start their home health care agency practice. I also chose to work as a consultant and contractor as Director of Clinical Services, where I managed each and every clinical spectrum or role, from social worker to case manager, contacting physicians, risk management, HR, CPR, licensure, etc. It's important that we leave no stone unturned. Patients rely on us to help them through these crises. The patients, many patients in rural and low-income areas went from the emergency room to back home to die of COVID because they didn't have access to care. And that is a shame. That is a shame that should not occur. We can help change the health system. The financially driven health system needs to be rebuilt, restructured, And what would it be like if nurses were key elements of driving the system? What if the system was driven by health and wellness, not sickness and COVID? That sickness and COVID is a money sucker. What if folks stayed healthy? They had help from nutritionists, dietitians, social workers, case managers, home care nurses, physical therapists in their home setting. And they stayed well. And nurses could assess and evaluate their practice as they helped those folks stay well. We can do it. We can do it. And as we, nurses, monitor our practice, it helps encourage others in our practice. We know caring is sharing. We have new grads who are coming to the hospitals to work. Some of them are working in doctors' offices, but many of them are overwhelmed. Help those new grads on their road to success. As we help each other one at a time, we become better. And it is our goal to touch the lives of people each and every day, whether they are our patients, our clients, or customers. Everyone deserves health and wellness. Everyone that you meet. So, today, let's promise to help each other, because together we are better. Together we can help more people be well. Together we can help more people be happy. Together we can help more people help other people in their family, in their community. And that would be a beautiful outcome or result from the service and care that we provide. Each and every day, we have an opportunity to help someone have a better life. And that will help nurses have better lives as well. We can quench some of those stressors if folks are well and they're taking their medication at home and they're adjusting their diets and their exercise and they're sleeping longer. You too can have access to the success of having good meals, required sleep, less stress, diet and exercise regimen that helps you keep your life together and employ those same health and wellness strategies that you have shared with your patient or community. You are human too. And remind people that yes, we are people and we are not robots. But we are here for the community of persons who need our service and care. So let's stay well ourselves. Self-care is so important. Stay well so that you can make changes in the world. You know, we've made many already. How many people have had the opportunity to save someone else's life by the education? Education is really important, where we learn things like vital signs, CPR, education, employment, and expertise in the healthcare system can help you save a person each and every day. Let's do what we do best, and let's do it together. Ladies and gentlemen, nurses' lives matter. We'll see you soon. Find us on Facebook, Instagram, Twitter, and LinkedIn. And our coaching sessions are available. We'll be starting another group in the next month. So find us at powerinnursing.com, and you can call us. You can call us or DM. We'll find you as soon as you reach out. Book a session and let's learn how to make our lives less stressful and more impactful for the world. We'll see you soon. Bye-bye now.